This is Zach. Like 40 million people in the United States, Zach isn't eligible for Medicaid or Medicare and doesn't have insurance from an employer. Like the others in his situation, Zach is stressed. It's not that he doesn't have insurance, he does. He pays $300 a month for the silver plan he bought through the insurance exchanges, but he's still stressed about the copays he might be responsible for and his deductible, which is more than $3,500. Zach has $1,200 in the bank, for now. After his rent and car payment are due on the first of the month, he'll need to use all of his paycheck and some savings to pay his bills. It's the same every month. This means Zach decides not to go see a doctor, which only ends up increasing his future medical costs. And if something goes wrong and Zach really needs to use the healthcare system, he has no way to pay his deductible. That's stressful and confusing. Isn't insurance supposed to protect us rather than stress us out? If insurance doesn't really protect us, why is healthcare built around insurance? We thought about these questions and came up with a new one. What would a healthcare system for 40 million uninsured Americans look like if insurance didn't exist? First, we need to look at the costs of our current system for those 40 million Americans. When you add up insurance premiums, copays, deductibles, non-reimbursed expenses, and billing and administration expenses, you end up with a system that is far more expensive than the actual cost of healthcare. Now think about what would happen if we took insurance out of the equation altogether. Without insurance, the cost of healthcare would be equal to, well, the cost of healthcare. Without insurance, we could all buy the healthcare we want or need. Instead of giving our money to insurance companies and then fighting to get it back to cover the cost of care, wouldn't it cost less to just buy our healthcare directly? Of course it would. But how would we pay for it? It's called a single guarantor system. Unlike a single payer system where the government pays for medical bills, under a single guarantor system, individuals pay for their own care, but can borrow money from the government to cover any costs they cannot afford. The government will already guarantee a loan for your house, your tuition, your small business, and plenty of other things. And with some of those loans, the government only requires individuals to pay back what they can afford. This is called means-tested repayment. Why couldn't our country guarantee loans for healthcare in exactly the same way? Think about Zach. Let's put that insurance payment back into his bank account. Now Zach has an extra $3,600 a year. He can put it in a tax-free health savings account, or save it, or knowing Zach, he'll probably just spend it. But if Zach ever needs healthcare, he can walk into any provider and pay directly, hopefully with the money he saved. He can get the same prices that the big insurance companies negotiate, or find the best price on his own from an approved healthcare provider. Under a single guarantor system, if the total cost is more than he can afford, providers can still charge Zach for the cost of care and get paid within 30 days. So the provider just scans Zach's driver's license or state ID and checks a box for approval to determine his income through the IRS and his bank account levels for direct debits. At the end of the month, Zach gets a statement, just like a credit card bill, that tells him how much he owes that month based on his current income. It could be as low as $10 or higher, depending on the formula that will determine how much he owes. All of this data also goes back into the system, allowing us to search for fraud and find ways to make improvements. This also means we can publish pricing and rate providers to make consumers and patients better informed and healthcare markets increasingly competitive, even in small markets. Let's see how our plan would work if you have to have a major surgery. Let's say you live in California and earn $50,000 a year. If you have to have your appendix removed and don't have any insurance, you'll be responsible for the full cost of surgery, an average of $33,000. If you have an ACA Silver plan and your hospital and doctor are all in-network, your insurance negotiates a better price with your provider, so the price of your surgery is much less than without insurance. But you'll still have trouble paying your bills that first month after surgery. First, you owe your monthly premium, about $300. After the surgery, you have to pay 100% of your deductible, another $2,500. Add to that your hospital copay and the 20% coinsurance you have to pay after your deductible, and at the end of the month, you'll owe more than $4,000. Assuming you keep the same plan but don't have any other medical expenses, you'll spend about $11,000 on healthcare over 2 years. Now let's look at our plan. We negotiate the same, if not better, prices than the insurance companies, and you don't have to worry about staying in network. You have no monthly premiums, no deductibles, no copays, and no coinsurance. At the end of the month, you'll owe no more than 15% of your income, just $625. You'll continue to pay at least this much until you've repaid the program for your surgery. Making just the minimum payment, you will pay off your surgery completely in 18 months. And even if you lose your job or have to have another procedure, you'll never owe more than you can afford. Isn't that less stressful? Does this program replace the exchanges created by the Affordable Care Act? Yes. Why wouldn't individuals just stop paying their bills? Because the payments are means tested, individuals could owe as little as $10 a month. Plus, everyone realizes they will need healthcare at some point in their lives. By not paying their bills, individuals risk losing access to their care. What if an individual has an expensive procedure that they will never be able to pay off? Individuals will need to make payments monthly based on the system's calculation of what they can afford. With payments as low as $10 per month, we feel this is more reasonable than requiring people to pay insurance premiums for their entire lives with the constant risk of losing coverage after one missed payment. Will this program negotiate discounted pricing for drugs? Yes, similar to the way we will negotiate with healthcare providers, we will negotiate with drug manufacturers to get the best prices for patients and reduce the net cost to participants. Will every provider be required to accept this program? No, but we expect that most will. For providers, accepting this program is as good as cash because they will be paid consistently every month. In addition, the reduction in administration costs will incentivize participation. Can individuals get their prescriptions refilled automatically? Yes. Using the data from this program, we can work with retailers and pharmacies like Walmart, Sam's Club, and Amazon so that patients can have their prescriptions filled automatically at the cheapest source. Can anyone choose to have expensive or elective care even if they know they can't afford it? No. We will use Medicare's guidelines as a starting point to define acceptable usage of the program. Could individuals purchase insurance using the program if they wanted to? No. Insurance would not be an eligible purchase under the program.